Hello, everybody. I would like for you to guess what disorder this is. Each X represents an alphabetical letter. So I'll just give you a minute to think about this. One reason to give a diagnosis disorder is to make decisions treating the problem. It also helps us to understand the nature of the symptoms. Have you guessed it yet? Surprise! It's antisocial personality disorder. So here's a little bit background of antisocial. This disorder is a persistent pattern of internal experience and behavior that differs from what people consider normal within the person's own culture. They may view the world as a hostile place where it's everyone for themselves. They're very self-centered. And survival is only possible by harming and manipulation others around them. This diagnosis can be very dangerous to others. And it also leads to criminal behavior. Now I want to address the DSM-5 criteria. There is a pervasive pattern of disregard for and violation for the rights of others, which usually occurs since the age of 15. And you have to have 3 or more of the following criteria. And I'll let you just read these for a few minutes. Okay, now let's move on. So now I'd like to share with you some identifying information. This is a summary. And this is who I would like to introduce you today that has been brought into the facility for counseling. Rennie Walker is a 28-year-old widowed Caucasian who identifies herself as female, whose birth date is unknown. She was born in 1959. She currently resides at the Fulton Prison Facility. She speaks English as her primary language with no communication barriers at this time. She answered questions evasive, and she stated, "No one can know if I love only if they live in my world." Rennie reported she was born in Charleston, but real birth origin is unknown. She has not made any reports of known family. She reported of having only one short-term girlfriend. She has had several aliases: Catherine Russell, Marielle Rice, Margaret McCrory, and last known alias is Rennie Walker. During these time of aliases, she has changed the features of her hair for each alias, the nature of her language, or code switching to gain the approval of her future husbands. Rennie presented lack of emotion, flat affect, and non-remorseful. So Rennie has recently been brought in to the Fulton Prison Facility for counseling. Her current mental health symptoms are as follows. She has the incapacity to experience guilt. She's proneness to blame others. She has superficial charm, manipulation. She's deceitful. She has lack of remorse and shame. And she has had a pattern of immoral and criminal behavior 3 times, with almost a 4th. She has difficult from learning from experience. And she has poor insight, impulsivity, and anger. Her social, unknown family, and loner. Some of these assessments that was used during her intake was the PLCR. She scored a 34, which indicated antisocial personality disorder. We also did the DLA-20. She scored an 18. Areas identified were severe impairment in functioning included family relationships, communication, problem solving, social network, and coping skills. We also did the Audit C and DAS-10. She scored a 0 on both of those. And the PHQ-9, which was also a 0 as well. And the GAD-7, which was a 0 as well also. So here's some more information on the assessments. It's very important for us to have collaboration among staff, doctors, nurses, and counselors for the efficient treatment of Rennie. So this is why I'm laying out all this information so we can come to agreement of how we want to go about everything and discuss it, or each individual thoughts about what would be the best service provided for her. So a clinical recommendation of treatment would be she could benefit from individual counseling, reasoning, and rehabilitation, which is offered here at the Fulton Prison facility. And I have also made her appointments concurrently at 3 p.m. every Wednesday, so she will have consistency. The recommended treatment is individual counseling, reasoning and rehabilitation group with like diagnoses, and CBT. Some medication recommendations that I think that might be useful would be antidepressants, which is helpful for depressed moods, anger, impulsivity, irritability, to help manage her behavior. There's also some others such as Paxil, Zoloft, Prozac, and Cymbalta. And these also help stabilize mood swings. The best documented medication is lithium carbonate. It has been shown to help with explosive and impulsive behaviors. I would like to introduce you to Black Widow. This is a character, Rennie Walker, that has the symptoms and meets the criteria for antisocial personality disorder. So do you notice the flat effect on her face? And here you see one picture where she is poisoning her husband's wine bottle with Odonine. And if you've noticed, in every one of these pictures, she has changed her physical features, her color of her hair, her dressing has always been fluent and flashy. And she seems very confident in these pictures. So reason for referral, one is she was court-mandated counseling for crime, which was murder. I would like to share with you, this is how Rennie met her criteria for the antisocial personality disorder. Well, number one, she met the failure to conform to social norms. There's a pattern of client poisoning her 3 husbands and almost a 4th, which is grounds for arrest. Number 2, she presented herself as deceitfulness. She had 3 known aliases, lying to everyone, being deceitful, and again, murdering 3 times to gain wealth. She met the criteria of number 3, impulsivity or failure to plan ahead. She impulsively murdered her husbands, then left town to find another mate. Obviously, she didn't plan on getting caught and the consequences that would follow. She also met number 4 criteria, irritability and aggressiveness. She presented irritability, of course, with her crimes, which were uncovered by a federal agent. She presented herself aggressive when she almost let her girlfriend drown. She waited to the last minute to give her air from the scuba mouthpiece. Rennie also met the 5th criteria, reckless disregard for her safety and others. She planned murders of her husbands and attempted to harm her friend. She met number 6 criteria, which was consistent irresponsibility as indicated by repeated failure to sustain consistent work behavior. She did not have normal employment. She stated she looked at getting wealthy from late husbands as job. And she always thought she would have enough at one point, but then she never did. She had to have more money. And lastly, she met criteria 7. She had a lack of remorse as indicated by being indifferent, having hurt, mistreated, or stole from another. She presented herself as lacking remorse, taking charity money from the will that her husband had left to the Cancer Society. She had no guilt for murdering. So some treatment that I think that would be beneficial for her. Well, first of all, antisocial personality disorder is one of the most difficult to treat. People with this disorder rarely seek help on their own. As formerly, as we were just talking about, Rennie was going to murder her 4th victim, but the consequences were that the federal agent got to him before she did, which saved his life, and she was obviously just going to move on and find another mate. It wasn't until then that when she got caught, now she's having to have help. It's very important for us to have an interprofessional team approach with patients with this disorder to receive the best care possible. That includes physicians, nursing and staff, pharmacists, counselors, court system. We all need to be on the same page and work together. Some type of treatment techniques that I think that would be beneficial for her would be CBT. To treat anti-personality disorder, this technique helps the individuals to identify destructive thought and pattern behaviors. So we're going to take her from, right now she's egocentric and she's thinking that her behaviors are normal, okay, whereas to cultural, it's not normal. So we're going to help her to understand and identify and have behavioral change that these ways of thinking and these actions are not normal. Another one is schema focus therapy. It also helps to identify thought and behavior patterns. And lastly, we have a program here in the facility at the prison called Reasoning and Rehabilitation, and it focuses on reducing and offending and their behavior. It has a lot to do with educating them coping skills. This is done in a group. It also helps with interpersonal relationships or as well intrapersonal relationships. And I'll let you just read this for a minute. I think whichever treatment that we choose to do for Rennie, I think it's important for us to provide support and encouragement while she's on her journey. And this will also help us to build trust with her. As well, it's also important for, during these interventions, to provide booster sessions and follow up close monitoring to see how she's doing with her success and her progress. And by this, we're also going to be modeling positive behaviors and reinforcing those positive behaviors as well. So here's some thoughts and concerns I would like for you to look at. So I want to talk a little bit more about treatment planning. It's important for the individual, like Rennie, to have a person-centered treatment plan. Let her be in on the treatment planning. After all, she is the one that's going to have to work on this to reach her goal. So have her decide what she wants to work on. That, you know, it's going to spark her interest. So therefore, she'll be more motivated to do these objectives and interventions and coping skills and assignments that I would like for her to do. There has been some evidence from clinical trials The antisocial personality disorder shows that positive and reinforcing approaches to the treatment of this disorder is more likely to be successful than those that are negative. And here's just a little sample of a goal and some objectives that she can do to help reach her goal. And the intervention will be the part that I will do as the counselor to help her reach her objectives and her goal. Here's some more on some medications. So some consideration that I would like for us to talk about. When we provide psychological or pharmacological interventions for antisocial personality disorder, we need to be aware of the types of drugs that we're giving them, because some of them are highly addictive. And as far as I know, since Rennie she scored a 0 on the audit and the DAST assessment. We might not have to worry about this with her, but thinking ahead to other potential clients, we would need to think about, what types of medication that we give, and we also need to be aware of them hoarding them or cheeking them in their mouth and then taking them back to their cell. So we need to be concerned about that, make sure that they're taking their medications when they're in the sight of the staff. So my last thought would be, with the help of our supporting team, Rennie can begin her journey with acceptance and changing her behavioral and thinking patterns to promote emotional and physical well-being. So here's a clip that I have downloaded for you guys to watch. I hope you enjoy, and thank you for joining me. Bye-bye.